With COVID-19, as you might have seen across the globe, we would have given quality care, but we would have lost a lot of persons. A lot of patients would have died. And it's not necessarily because of the care that they would have given, but this man named COVID-19, he has been horrible. He's really hit persons of all different categories, all different levels, all different financial levels, all different social levels, social backgrounds. It doesn't matter. So even though you're giving the care that has been studied, because yes, from the moment that COVID-19 came out, studies started, because we have to get this done. We have to find out what is in the best interest of persons, what can we use, what treatment can we use. But unfortunately, even with all of that, we have lost patients. And this has obviously affected our staff. It has been different. It has been challenging. It has been heart-rending. But we have an awesome team.
I started working at the COVID center, known as the Infectious Diseases Hospital, ever since it was opened. That was my actually first job, because I applied to the Ministry of Health for a job, and I know that they would have needed people for the pandemic.
At the beginning, it was hard work and dedication. It was tough, to be honest, and seeing your patients recover from COVID, that is like the best feeling a nurse or a doctor could feel.
When COVID started, I was one of the first set of nurses that volunteered to go and work at Ocean View Infectious Hospital.
I've been a COVID ICU nurse since day one. For me, I love doing research like history on pandemics, anything related to the medical field. So when I started the research on COVID-19 and I realized that, sooner or later COVID-19 will reach Guyana, I opted and volunteered to be a part of the team.
In COVID ICU, it was challenging, especially during the peak season. Had a lot of challenges such as deaths, as we know. It's not an easy thing to deal with for the family, for us.
During the peak season, it was very tough. It was challenging, but it was like a priceless reward for the fact that Ocean View is an enclosed hospital. There's no visiting there. So you get to be the patient's relative, you get to be the person, their go-to person, you get to be the person that they fully depend on holistically in every aspect.
I was a bit fearful entering into the unit because you didn't know what to expect. And a lot of Guyanese, they were fearful of COVID-19, but the minute I entered in the unit, I realized that I have to get rid of that fear because all my patients are fearful. So I couldn't be fearful and my patients be fearful.
We have our psychologist that was actually always available for us. From the very beginning was always available, and then we had that psychologist permanently at the Ocean View every single day, available for staff and patients. So motivating staff, we have been doing that and different methods, speaking to them one-to-one, one-on-one, suggesting outings, suggesting time off, days off. Our schedule is good enough so that they have quality family time as well. You protect yourself, you put on your personal protective gear throughout your stay at work. But contracting COVID does not mean necessarily because I work at Ocean View or the Infectious Diseases Hospital, that is where I got COVID. We all have our personal lives.
We would have had nurses that would have contracted COVID. The good thing about it was that even though they would have contracted COVID, they never thought about leaving the hospital after that. They came back and they worked the same way they were working before.
It'll be really nice to wake up one morning and not have to worry about COVID-19. It will be really nice.